Hi, Kevin Sartin with Non-Monogamy Physical Therapy with an educational video on snapping hip. So snapping hip occurs whenever we have structures that cause a snap in our hip, typically happening with a flexion or extension movement in our hip, which is typically accompanied by pain. There's three different kinds of snapping hip that occur, and they're typically aggravated by the same types of movements and activities, but the difference is their location. So there's an external snapping hip, which is typically associated with our iliotibial band or IT band on the side of our hip, and that is where the snapping and the pain will occur. There is an internal snapping hip, and that is typically located in the front, associated with the iliopsoas or hip flexor tendon. And then there's the intra-articular snapping hip, which occurs on the inside of our hip joint. So all of these are typically aggravated with flexion and extension movements and can be associated with things such as running, cycling, dancers, and typically occurs in the younger active population. You can also have pain and popping or snapping with activities such as walking, going up and down stairs, getting in and out of a car, anything that is taking our hip through that movement pattern. Treatment options for snapping hip are physical therapy. So that's one of them. And physical therapy is most beneficial, most effective, I should say, with the external and internal snapping hip. So they have about PT has about a 70 to 90% success rate in helping to solve those issues, reduce their pain and the snapping both. The intra-articular snapping hip is about a 40 to 60% success rate in solving that problem. There's also other pharmacological options, so whether that be NSAIDs or Tylenol to help with short-term relief, or injections such as corticosteroid, hyaluronic acid, or PRP injections. Those can all be helpful in short-term pain relief as well. And then if these conservative options do not solve the problem, there is also a surgical option, which is fairly effective. It has a 70 to 90% success rate at reducing these symptoms, and that's going to be a release of the tendons involved if it's an external or internal. So they'll either do a release on the IT band or the iliopsoas tendon. And if it's an intra-articular snapping hip, typically it's going in and removing the loose body that's within the joint, whether it be a labrum or something else that was in that joint causing that snapping to be felt. So hopefully you learned a little bit there. If you have any questions or need additional help, please give us a call or visit us at our website at notpt.com.